Welcome back, everyone. Just imagine, a single blood test telling you this whole hidden story about an animal's health. Revealing everything from maybe a minor issue to a really major crisis.
It's pretty incredible we can learn.
Exactly. And today, we're unlocking one part of that story through one specific indicator, equine neutrophilia. Feels a bit like a secret language, doesn't it? And we're here to help you translate it.
That's a great way to put it.
Yeah,
And maybe we should start with the neutrophils themselves.
good idea.
Okay, so think of them as the frontline soldiers of a horse's immune system. Really crucial. They're the most common type of white blood cell horses have.
Right.
And their main job, their primary mission, is basically to find and destroy bacteria, fungi, invaders, essentially.
Yeah.
And they also respond immediately to inflammation anywhere in the body.
Okay, so they're the first responders.
Pretty much, yeah. Key part of that innate immune system.
So our deep dive today, our mission, is really about understanding why and increase more of these soldiers, why that can be such a significant red flag. What's the body actually trying to say when these numbers go up? And does it matter how much they go up?
It definitely matters. The degree of increase tells us a lot.
Okay, let's get into the basics then. What exactly is equine neutrophilia?
Simply put, it's when the total number of these neutrophils, these critical cells, in a horse's blood goes above the normal reference range. The healthy baseline.
So it's an alert signal.
It absolutely is. And it's crucial to understand this usually means the immune system is actively responding to something. It's not necessarily compromised, which is what a low-count neutropenia would suggest.
Ah, okay, so high means active, low means potentially weakened.
Generally, yes. And what's really interesting in horses, their neutrophilic response to inflammation can sometimes be less dramatic than what you might see in, say, dogs or cats.
Huh.
Yeah. You could even have a horse with pretty significant inflammation, but its neutrophil count might still technically fall within that normal lab range.
Wow, okay, so that could be misleading then.
It can be a bit counterintuitive, yeah. You have to look at the whole picture.
That's a really important point. So it's not just a simple high or normal. You mentioned different degrees of increase matter, too.
Exactly. We often categorize it mild, moderate, marked, even extreme neutrophilia. Each level gives you clues about how intense the underlying issue might be. Mild might be, say, 7 to 14,000 cells per microliter, moderate 14 to 20, marked 20 to 30, and extreme is anything over 30,000. Though those ranges can vary a bit lab to lab.
Got it. Different levels of alarm bells ringing.
Precisely. And remember, the number we see in the blood test isn't static. It's always changing. It's this dynamic balance.
A balance between what?
Between how quickly neutrophils are made and released from the bone marrow, how they're distributed in the blood like. Are they actually circulating where we can measure them? Or are they temporarily stuck to blood vessel walls, what we call the marginating pool?
Okay, the parked ones you mentioned.
Exactly, the parked ones. And then how quickly they're used up or removed from circulation. That blood sample we take, it only measures the circulating pool, the CMP.
And these cells don't stick around long.
Not really. Their half-life in the blood is pretty short, maybe around 10.5 hours on average.
Oh, wow.
Yeah. And meanwhile, the bone marrow is just constantly churning them out. That's granulopoiesis. Normally, it takes about 6 days for a neutrophil to mature and get released.
6 days.
But, and this is key, if the body suddenly needs a lot more, say due to infection, that whole production line can speed up significantly.
Right, the factory goes into overdrive.
You got it.
Okay, so it sounds like these numbers fluctuate based on production, release, barking, and usage. What are the main drivers that actually cause the count to go up?
Good question. There are really two main ways this happens, two primary mechanisms.
Okay.
First, and this is the most common reason we see neutrophilia, is increased release from the bone marrow. This is that classic demand-driven response you see with inflammation or infection.
Right, the body calling for reinforcements.
Exactly. When a horse has an infection, acute or chronic, or significant inflammation, its body releases these signaling molecules, cytokines, things like GCSF, IL-1, IL-6. Think of them as chemical messengers.
Okay.
These messengers basically tell the bone marrow, hey, open the reserves, push out more neutrophils now. It releases cells from the storage pool of mature neutrophils first.
Ah, the ready-to-go ones.
Right. And if that inflammation or infection drags on, the bone marrow actually increases its overall production capacity. That's called hyperplasia. It builds more factory lines, essentially.
Makes sense. So that's pathway one, more production and release due to demand. What's the second pathway?
The second one is a bit different. It's a shift from that marginating pool to the circulating pool. Remember those neutrophils temporarily parked along the blood vessel walls?
Yeah, the MMP.
Right. Well, when a horse experiences significant stress releasing its own stress hormones, like cortical, or if it's given corticosteroids as medication.
Like dexamethasone or prednisolone.
Exactly. Those hormones cause the parked neutrophils to detach from the vessel walls and rejoin the circulating pool.
So the total number of neutrophils in the body hasn't necessarily changed, just more are flowing where you can measure them.
Precisely. The count goes up on the blood test, but it's more of a redistribution. This type of neutrophilia is usually milder, and critically, you typically don't see immature neutrophils being released. There's no left shift.
Okay, that's a key difference.
It is. And this stress response often comes as a package deal, what we call a stress leukogram. You see the mild neutrophilia, but also usually a decrease in other white cells, especially lymphocytes and eosinophils.
Lymphocytes down, neutrophils slightly up. Classic stress pattern.
That's the one. And interestingly, even just a sudden burst of excitement, fear, pain, or really brief, intense exercise can cause a similar but very temporary, like 20-30 minutes, mild neutrophilia. That's more adrenaline-driven. Sometimes you even see lymphocyte numbers go up briefly with that, and red cells too from the spleen contracting.
Fascinating how quickly the body can just shuffle these cells around based on immediate needs or stress.
It's a very responsive system.
Okay, so we have two main ways the number goes up. Make more due to inflammation infection, or mobilize the parked ones due to stress or excitement. With those in mind, what are the most common sort of culprits or underlying conditions that actually cause neutrophilia in horses?
All right, let's break down the usual suspects based on those pathways. By far, the most common and usually the most clinically significant cause is inflammation or infection.
Right, pathway one.
Exactly. And this is a huge category. We're talking things like localized bacterial infections, abscesses somewhere, maybe deep in a muscle or hoof.
Yeah.
Or more systemic things like pneumonia, pleuritis, which is inflammation around the lungs, peritonitis in the abdomen, bad cellulitis, septic arthritis in a joint. Strangles is a classic example.
Yeah.
Kidney infections, uterine infections after foaling.
So lots of bacterial possibility.
Definitely. Also, significant gut inflammation colitis or enterocolitis, think Salmonella, Clostridium infections, or even inflammation caused by NACI side effects like dorsal colitis. Internal abscesses can be tricky to find but can cause really profound neutrophilia.
Wow.
And of course, significant trauma or tissue damage counts too. Major injuries, burns, even just the inflammation after big surgery. Pancreatitis is rare in horses, but that would fit. And some immune-mediated diseases can also drive it.
Okay, so inflammation infection's the big one. What's next?
Second, as we discussed, is that stress or corticosteroid administration pathway.
The redistribution effect.
Right. Any significant physical stress, think colic pain, the stress of being shipped long distances, just being sick for a while, or psychological stress, or giving therapeutic corticosteroids, can trigger that stress leukogram. Mild neutrophilia, mostly mature cells, often with that drop in lymphocytes.
Got it. Stress response.
And the third category, thankfully much less common, is neoplasia, meaning cancers.
Okay.
Now, true leukemia, where the neutrophils themselves become cancerous and proliferate uncontrollably, is extremely rare in horses.
That's good news.
It is. But what you might see sometimes is something called a paraneoplastic syndrome.
Paraneoplastic.
Yeah, it means related to cancer. Some solid tumors, like lymphoma or certain carcinomas, even though they aren't blood cancers themselves, can actually produce those growth factors like GCSF we mentioned earlier.
Ah, the signaling molecule.
Exactly. So the tumor tricks the bone marrow into pumping out more neutrophils, even though there's no infection. The neutrophilia is a side effect of the cancer being there.
Wow, that's sneaky of the tumor.
It is. It can really muddy the diagnostic waters sometimes.
And I think you mentioned briefly giving that growth factor GCSF directly as a medication could also cause it, though that's probably quite rare in practice.
Very rare, yes,
Yeah.
but theoretically possible. It's sometimes used in specific situations, maybe severe neutropenia, but it's not common.
Okay, so inflammation infection, stress steroids, and much rarer cancer-related effects. That covers the main causes. Now, here's where it gets really interesting for the owner and the vet. If a horse has neutrophilia, how do you play detective? How do you figure out which of those causes is the culprit? What's the process?
Yeah, that's the crucial next step. It really is like detective work. And we always start with the basics. The clinical signs the horse is showing.
What the horse looks like, how it's acting.
Exactly. Is there a fever? Is the horse lethargic, off its food?
Mhm.
Is it lame, showing signs of colic, diarrhea? Is there obvious swelling somewhere? Or, if we suspect a stress response, maybe the horse just seems generally unwell, painful, or maybe it's just reacting physiologically to being handled or transported. The clinical picture provides the first big clues.
Makes sense. Start with the patient.
Always. But then, the linchpin for confirming neutrophilia and getting more detail is the complete blood count, the CBC.
The blood test itself.
Right. That gives us the hard data. First, the absolute neutrophil count that confirms, yes, the number is definitely above the reference range.
Check the box. Neutrophilia present.
Correct. Then we look really closely for a left shift. This is super important.
You mentioned this more immature neutrophils.
Exactly. Specifically, we look for an increase in what are called band neutrophils. These are neutrophils that got pushed out of the bone marrow a bit early before they fully matured into segmented neutrophils.
Like recruits sent to the front line before finishing basic training.
That's a perfect analogy. Seeing a significant left shift tells us the bone marrow is under intense pressure to release cells, usually because of a high demand from severe inflammation or infection.
So a left shift points strongly towards that first pathway, the inflammation infection one.
Very strongly. And if the left shift is really pronounced, including even younger forms like metamyelocytes and myelocytes, that suggests extremely intense inflammation. Now, there's also something called a degenerative or uncompensated left shift.
Oh, that sounds bad.
It usually is.
Right.
That's when you see more immature neutrophils than mature ones, but without the overall neutrophil count being high, or maybe it's even low, it means the tissue demand is overwhelming the bone marrow's production. That's generally a poor sign prognostically.
Okay, so left shift inflammation, degenerative left shift, overwhelming inflammation.
Basically, yes. Though it's worth noting, with very chronic, long-standing inflammation, the bone marrow might have had time to ramp up production sufficiently, so you might not see a left shift anymore, even though the inflammation is still there.
Ah, okay. Another nuance. What else on the CBC?
We also look for toxic change in the neutrophils themselves.
Toxic change, what does that mean?
These are actual visible changes in how the neutrophils look under the microscope. Things like dull bodies, which are little gray patches, increased blueness or graininess in their cytoplasm, maybe some foamy vacuoles.
So the cells themselves look stressed.
Exactly. It indicates they were produced very rapidly, often under the influence of inflammatory mediators, usually due to intense inflammation, severe infection, or maybe endotoxemia, that systemic response to bacterial toxins.
Is toxic change always serious?
Usually indicates something significant is going on.
Uh-huh.
However, sometimes you can see mild toxic change in horses that otherwise seem, okay, so context is key. But seeing toxic change resolved during treatment, that's a very positive sign.
Okay, so ANC, left shift, toxic change. What else?
We look at the other white blood cell trends too. As we said, seeing lymphopenia, low lymphocytes along with neutrophilia strongly suggests that stress leukogram pattern.
Right, points towards stress or steroids.
Correct. Seeing monocytosis, high monocytes, often crops up with chronic inflammation. High eosinophilia might make you think about allergies or parasites as a contributing factor. And of course, we always check the red blood cells for anemia and the platelets too, just to get the complete picture of what's happening hematologically.
Wow, okay, so the CBC is packed with clues, not just the neutrophil number itself. But that's still mostly blood work. What other tools do vets use to really pinpoint the source of the problem?
Great question. Because the CBC tells you there's inflammation or stress, but not where or why.
Okay.
So the investigation absolutely continues. A thorough physical exam and getting a detailed history from the owner are paramount. We're trying to localize the problem, listening to the chest, palpating limbs, checking the abdomen, asking about recent travel, diet changes, medications.
Putting the puzzle pieces together.
Exactly. Then we often turn to acute phase proteins. These are other blood markers that indicate inflammation. Fibrinogen is a classic one in horses. If it's persistently high, say over 400 milli-GDL, that strongly suggests significant inflammation.
What, Brinogen? Okay.
And another one, maybe even more useful now, is serum amyloid A, or SAA. It changes much more rapidly than fibrinogen, both going up and coming down. So it's excellent not just for detecting inflammation early, but also for monitoring how well the treatment is working in real time.
SAA, faster response marker. Good for tracking.
Very useful. Then, if we suspect an infection is the root cause, cultures and sensitivities become critical.
Finding the actual bug and what kills it.
Precisely. We might do a blood culture if we suspect sepsis, systemic infection, or take samples directly from the suspected site, a tracheal wash fluid if we suspect pneumonia, joint fluid from a swollen joint, aspirating pus from an abscess.
Get the sample to the lab.
Yep, and imaging is often essential.
Mm.
Ultrasonography is fantastic for looking inside the body non-invasively. Really useful for finding internal abscesses, checking for fluid in the chest, pleuritis or abdomen peritonitis, evaluating cellulitis.
Ultrasound sees soft tissues and fluids well.
Extremely well. Radiography or X-rays are still key for bones, joints, sometimes pneumonia in the chest. Endoscopy lets us put a camera inside, looking down the trachea into the airways, or into the stomach and upper intestine.
See the inflammation directly.
Right. And sometimes, for really hidden problems like deep abscesses, we might even use more advanced imaging like scintigraphy, though that's less common. Other procedures might include things like rectal palpation for abdominal issues, maybe taking a biopsy or cytology sample from a mass or fluid, or in very rare cases where we suspect leukemia, a bone marrow aspirate.
Okay, quite an arsenal of diagnostic tools beyond the initial blood work.
Absolutely, you need to follow the clues.
So let's say you've done the detective work, you have a likely cause for the neutrophilia. What does this all mean for actually treating the horse? It sounds like, fundamentally, you're not treating the high neutrophil number itself.
You've hit the nail on the head. That is the absolute core message. Treatment for neutrophilia is entirely dependent on successfully identifying and managing the underlying cause. The high neutrophil count is just a sign, a symptom. It's not the disease itself.
So you don't give medication to lower the neutrophil count directly?
Generally, no. The goal is to resolve the reason why the count is high. And actually, if the neutrophilia is just that physiological stress response, mild, no left shift, maybe linked to transport or a vet visit, it typically doesn't require any specific treatment at all, beyond maybe addressing the source of the stress if possible.
Okay, makes sense. So for the cases driven by inflammation or infection, what are the main therapeutic approaches?
If a bacterial infection is confirmed or strongly suspected, then antimicrobial therapy antibiotics is usually crucial. Ideally, we base the choice on those culture and sensitivity results we talked about.
Targeting the specific bacteria.
Right. If it's something like an abscess, an infected wound, or septic arthritis, drainage and debridement are often just as important as antibiotics. You need to physically remove the source of infection and dead tissue.
Get the pus out.
Essentially, yes. Then there are anti-inflammatory drugs, non-steroidal anti-inflammatories, NSAIDs, like flunixin-megalamine or phenylbutazone bute, are very commonly used. They help reduce the inflammation itself, plus pain and fever that often accompany it.
Standard tools for horse vets.
Definitely. But we always use them carefully, especially if there's any concern about kidney problems or potential gastrointestinal issues, like ulcers or colitis, which they can sometimes worsen.
Right, always balancing risks and benefits. What about corticosteroids, the steroids?
Good question. Generally, corticosteroids are contraindicated, meaning you don't want to use them when the neutrophilia is caused by an active infection.
Why not?
Because steroids suppress the immune system. That's the last thing you want when the body is trying to fight off bacteria or fungi. They might make the horse feel a bit better temporarily, but they can allow the infection to get much worse.
Okay, so avoid steroids with infection-driven neutrophilia. When might they be used?
They might be considered in specific cases of sterile inflammation, like some immune-mediated conditions, or if the neutrophilia is clearly just part of that pure stress leukogram, and managing the underlying stress or pain is the priority. But even then, you have to be cautious, especially avoiding them completely if there's any risk or sign of laminitis, which steroids can trigger or worsen.
Big red flag there with laminitis risk.
Huge red flag. And then, underpinning all of this is often supportive care. Things like intravenous fluids if the horse is dehydrated, perhaps from the fever or inflammation, or if they have fluid losses from something like severe colitis or sepsis. And specific care tailored to the condition like nebulization for pneumonia, dietary changes for colitis, etc.
So antibiotics, drainage, anti-inflammatories, carefully, maybe supportive fluids. It's a multi-pronged approach targeting the cause.
Exactly. Tailored to the individual horse and the specific diagnosis.
And how do you know if it's working? If all that effort, the diagnosis, the treatment plan, how do you track progress?
Monitoring is absolutely key. We don't just treat and hope for the best. We regularly repeat those key blood tests.
The CBC again, and the SAA.
Precisely. We look at the absolute neutrophil count trend. Is it coming down, especially if it was very high initially, maybe with a left shift? Is the left shift resolving? Are the toxic changes disappearing? Those are all good signs.
The neutrophil picture improving.
Yes, and we track those. Acute phase proteins fibrinogen should start to decrease, although it can be slow. SAA being more responsive is great here. Seeing SAA levels drop significantly is a strong indicator that the inflammation is being controlled and the treatment is effective.
So watching those numbers trend downwards tells you you're winning the battle.
It gives you objective evidence that you're on the right track, or maybe need to adjust the plan if things aren't improving. So if we try and connect all this back to the bigger picture, the outcome, the prognosis for a horse that shows up with neutrophilia, it really hinges entirely on what's causing it.
Right. It's not the neutrophilia itself that dictates the future, but the underlying disease.
Exactly. That's not a simple answer.
So what's the kind of range of outcomes you might see? I imagine it goes from pretty good to, well, not so good.
That's right. You can have a good to excellent prognosis in some situations. Think about that mild, temporary neutrophilia from physiological stress that resolves on its own. Or maybe a small, localized abscess that's easily drained and treated with antibiotics, or a minor wound infection. Those horses usually do very well.
Okay, the simpler, treatable causes.
Yes. On the flip side, the prognosis can become much more guarded or even poor when you're dealing with severe, persistent neutrophilia caused by really serious underlying problems.
Like what kind of problem?
Things like overwhelming, uncontrolled systemic infection, sepsis basically,
Oh.
or deep-seated internal abscesses that are really difficult or impossible to drain effectively. Severe, widespread inflammatory diseases like advanced pleuritis or peritonitis, or really severe cases of colitis.
Things that are hard to get under control.
Exactly. Or if the underlying condition itself is very serious and maybe wasn't diagnosed quickly or is rapidly progressing. And of course, neoplasia, those cancer-related causes, especially true leukemia, which thankfully is rare, but the prognosis there is often considered hopeless, unfortunately.
That's sobering.
It is. And one potential complication, even in cases that start with high neutrophils, is if the inflammation is so severe and prolonged that the tissue demand for neutrophils completely outstrips the bone marrow's ability to keep up.
Ah, you mentioned this, they can actually run out.
Effectively, yes. The count can plummet, leading to neutropenia, which, in the face of ongoing severe inflammation, is a very concerning sign. It indicates the body's defenses are being overwhelmed.
Wow. Okay. We have certainly gone on a deep dive today, haven't we? It's clear that equine neutrophilia is so much more than just a number on a lab report.
Absolutely.
It really is this critical red flag, as we called it, that basically launches veterinarians onto this complex detective mission. The goal, find the real culprit, the underlying problem, and then treat that specifically. It's such a testament to how much information can be packed into these seemingly simple biological indicators.
It really is, and I think this raises an important point, maybe the key takeaway. Knowledge like this is most valuable when you understand it and can apply it. What really stands out is seeing how many layers of crucial information from the clinic exam, the details within the CBC like left shift and toxic change, the acute phase proteins, imaging how all those layers build upon what seems like just one simple number, the neutrophil count.
Right. It's about connecting all those dots.
Exactly.
Yeah.
Connecting the dots to build that full dynamic picture of what's actually happening inside the horse.
And it really leaves us, and hopefully you listening, with this provocative thought to chew on. What other seemingly simple medical indicators, maybe in our animals, maybe even in ourselves, what other numbers or signs might be signaling equally complex, equally vital stories happening just beneath the surface? Stories just waiting for us to stay curious enough to dig deeper and investigate.
It's a great question to keep in mind.
Definitely food for thought. Keep digging, keep exploring, and stay curious about these incredible biological cues. We'll catch you on the next deep dive.